Now, on Wednesday, President Obama is going to address a joint session of Congress. His focus, health care reform. The address comes as his health care plan has met sharp opposition, and his popularity rating has taken a sharp hit. Solon Simmons is a professor at George Mason's University Institute for Conflict Analysis and Resolution. He specializes in American politics and is a frequent guest here on CTV News Channel. Hi there, nice to see you.
Nice to see you again.
So what message is the president going to deliver to Congress on Wednesday night?
Well, I think he's going to try to take control again of this debate, which for reasons not all his fault has fallen into his opponent's hands. He's going to try to clarify the message for health care reform that he would like to bring forward. And he's going to emphasize that this is an insurance plan. It's not a health care plan formally. This is not about a government takeover, as many in the conservative ranks have tried to characterize it, at least not formally, because it's not about taking over the entire health system, but instead is about insuring people, giving an option, as they say, in the marketplace. So it's a different kind of option. He's going to want to clarify that. He's going to want to return to, and I think going to try to differentiate between a yes, we can policy and what a WAG has called a yes, we can't policy, which is, in fact, two ways of saying positive things. On the yes, we can side, of course, is the idea of a public policy which would allow the government to use its voice to put pressure to keep prices down in the marketplace, which is very important over the long run because healthcare prices are crippling the economy in some sense. And on the yes, we can't side is an idea that, yes, we can move forward, but not with the government, that we need to move forward with private solutions, exit strategies, threats of leaving, and market solutions. He's going to want to say that those kinds of market solutions are not enough, and in fact, a public option, a robust public option, will be important. Of course, that public option has been facing a lot of attack, and it might be behind a lot of his decline as of late in the polls.
And let's talk a little bit more about that, because it seems as though he has taken a hit over this. Then there's the controversy over the school address that he is going to make, and then there's a whole issue of Afghanistan. It seems as though the country is divided more so than ever. Is that a fair characterization?
Well, it's hard to say that it's divided more than ever. I mean, it's a very complicated thing to analyze. What I would say is this, is that there is a vocal minority in the United States, and it's a large minority, maybe 33%, who dislike the president and who criticize him at every chance and every turn. But what they're attacking is not so much what I was talking about before, which are these rational options to bend the cost curve so much, but the very legitimacy of his presidency. So you see the questioning of his birth, whether he really is an American citizen and deserves to be there. And I think it goes back to this inauspicious beginning, this idea you mentioned about whether he could speak to kids, but also the idea that perhaps there's a difficulty in the racial mixture so far still, that there's a sense, if you think at the beginning of this debate, we had the beer summit where there was this issue of a racial conflict, and Obama had taken a stand in that. That's how this whole healthcare debate opened, and I think many people have questioned that legitimacy. Not the majority of Americans. There is a minority. Not to say that all the people who are reacting to it, but there is something which is beneath the surface, if you will, percolating a discomfort with the legitimacy of this president, which I think is playing out beyond the rational, beneath the rational level.
Do you think ultimately that he's going to be able to come up with something that is going to get the 60 votes that he needs?
I think he probably will. There's a sense that this is very tactical at this point. The really big question is, will there be a public option or not? And effectively, therefore, will there be cost savings or not? Because the current plans, like those that Senator Max Baucus, an important Democrat, are proposing, probably would extend care, but not really lower the prices. So this might be the worst of all worlds. I think something will pass. If it doesn't, it'll be less what a South Carolina senator said would be his Waterloo, but perhaps more something like the Civil War with Bull Run, which is a devastating loss for the Democrats, which will lead to a long and symbolically bloody conflict over maybe the next 6 years. So this is going to be intense, and as you say, polarization is there.
Solon Simmons, thanks so much for talking to us. We'll be talking to you again, I'm sure. Appreciate your time tonight.
Okay, thank you very much.